Nishtha Trust was set up in 1995 by Dr. Barbara Nathweiser, who is now the director. Dr. Barbara is a general practitioner from Vienna, Austria, who has been living in Sidbari since 1984. The health center is dedicated to the memory of her late husband, Krishan Nath Baba, who was a respected spiritual personality in the area and was very concerned about the well-being of the local people. Nishtha's charitable clinic has been serving the local community for the past 30 years and is well trusted in the area. Our doctors provide holistic medical treatment, personal consultations, and take time to answer questions and give sound medical advice. Nishtha's team of 6 single women activists have been working in the villages of Dharmshala, Kangra, Shahpur, and Agrota blocks for the past 14 years. They identify widows, divorced, abandoned, and unmarried women who are in need of support. They hold meetings in the villages in which women meet and are able to talk about their problems and find ways to solve them. Our activists are very knowledgeable about the government schemes available to them and organize block meetings which are attended by lawyers, police, and welfare officers who answer questions and direct women how to solve their problems. Twice a week, our medical team packs up the car and goes to one of the outlying villages in which the single women activists work. They invite the local villagers, men and children as well as women, to attend a health education camp. Although we are not permitted to provide medicines, as prevention is better than cure, we offer to take the weight and blood pressure of anyone who requests it. Our doctors will explain various functions of the body and how you can influence your own good health by eating properly, taking exercise, avoiding alcohol and other stimulants, and seeking medical help when you feel you're not well. Nishtha works in 3 interlinked areas of perceived need in the local community. Health. The main focus of our work has been running a daily clinic. The majority of our patients are from local families. Many are widows or elderly people who depend on us for medical care. More recently, patients have been coming from far with a long list of consultation reports from doctors who have not had the time to explain clearly about the problem. If you come to us, we will take time to consider your problem carefully and will answer your difficult or private concerns. We offer consultations and medicines free to the very poor and destitute, and at nominal cost prices to those who can afford them. Our approach is holistic, and patients are diagnosed and treated utilizing the disciplines of allopathy, homeopathy, and acupuncture as appropriate for each individual patient. Serious cases are referred to the nearest specialty facility along with a vehicle and assistance if needed. Education. Nishtha Community Center has an active library and computer training room, which is open to children and youth of the village. It provides space for workshops, meetings, after-school programs, tuitions, crafts, and sports. Every afternoon, the community center is filled with the joyful sound of children's voices. We extend our library program into the villages by bringing a selection of children's books in Hindi to the outreach camps in order to encourage children to read. This is very important for children's development and future outlook on life. A group of differently abled children attend the community center where a selection of equipment and toys are available, and a physiotherapist comes as often as possible. We are very concerned about children with special needs and seek ways in which to help them. Special self-defense workshop known as Venlido, Women's Way to Strength, are held in the community center by two of our staff who are fully trained in helping women to overcome their fear in the face of aggression. We recommend that all girls take the time to attend one of our 3-day residential workshop in our center. Nishtha provides regular nutritional supplements to the children from 6 local schools and Anganwadis. Children need good food in order to grow strong and healthy. Eating chips and drinking sodas are not only very expensive for parents, but are also very unhealthy for children, leading to many health problems both in the short and long term. We provide snack items such as roasted chana, peanuts, namkeen, chuwara, dalia, soya bean, dals, and dried and fresh fruits. These are all good for children and they like them. During these dark days of COVID, Nishtha has been at the forefront in the local area in providing emergency care and relief from food poverty in the form of food packages and vouchers distributed by our team of single women activists. They identify those in real need. We provide 1,000 rupee vouchers to single women without income, the disabled, the elderly, and families in need. Nishtha also runs a very successful sponsorship program for students, mostly daughters of single women, to enable them to attend college and develop their confidence and skills as a part of very active Nishtha group. Environment. Nishtha has been concerned about environmental issues for many years. We hold regular programs to generate awareness of issues such as garbage management, water purity conservation, and tree planting. We train our local children and youth not to burn plastic, which gives off toxic smoke, which is very bad for health, and not to throw garbage into the streams, as this pollutes the water used by fields and villages downstream and damages wildlife and the health of the streams. At Nishtha, we have developed a machine to compress waste plastic into blocks that can be used in construction. This innovative use of recycled material is gaining acceptance in the local area and beyond. Please visit us in Rakkar village to see our small plastic recycling unit. On our farm, we experiment with and encourage the use of organic manure to grow vegetables. The use of chemical fertilizers and insecticides provides improved crops only in the short term, but in the long term, it is very destructive to the land, and spraying is a significant cause of cancer and infertility in men. We should also be aware that insecticides kill the bees that used to be provided homes in the walls of our village houses. Bees are the main pollinators of crops, so if they are not protected, there will be no food in the future.